Good morning. This is All India Radio Kohima. The morning news read by Jonas Yantan. Nagaland is all set to have the first ever biosafety level BSL-3 laboratory at Naga Hospital Authority Kohima, NHAK. State Health and Family Welfare Minister S. Pangyapom said the much-awaited BSL-3 lab at NHAK will be inaugurated today by Chief Minister Rio during a brief dedicatory program at 11 a.m. The Union Cabinet yesterday gave its approval to the Atmanirbhar Bharat package for allocation of food grains from central pool to approximately 8 crore migrants. 5 kilograms per person per month for 2 months, that is May and June this year, will be given to migrants free of cost. It would entail an estimated food subsidy of about 2,982 crore rupees. The Cabinet also decided to bear the expenditure towards intra-state transportation and handling charges and dealers' margin of about 127 crore 25 lakh rupees. Nagaland Principal Secretary Home Abhijit Sinha said that a total of 1,603 citizens of the state stranded in various parts of the country have arrived as on 4 p.m. yesterday. He also informed that a special train left from Chennai in Tamil Nadu for Dimapur at around 11:30 p.m. on Tuesday with about 1,320 stranded persons of Nagaland and is expected to reach Dimapur railway station by 1 p.m. tomorrow. Till date, he said 10,853 citizens have signed up in the End COVID-19 Nagaland Visitors app, and 503 health workers are assigned to help iOS mobile users and feature phone users to register in the End COVID-19 app. He said in the past 14 days, 1,365 persons have submitted their travel self-declaration, and currently 1,077 persons are being digitally monitored through the End COVID-19 Nagaland Visitors app. At a time when more cases of COVID-19 are being reported in the northeast region, particularly neighboring state of Manipur, the Angami Youth Organization, AYO, has questioned the Health and Family Welfare Department as to why it has withdrawn its personnel from Kohima Gate under Kohima district. AYO said that a medical team at Kohima was reportedly deployed on 24th of March this year, but were withdrawn on 14th of this month. It said reported claim on shortage of medical staff following the arrival of the returnees at the quarantine centers does not justify nor bring out any valid reason as to why entry check gates to the state have to be ignored. Expressing that in order to combat the disease, the entry and exit points to the state are crucial areas, AYO stressed on the need to be always vigilant at the check gates. It said till date, Nagaland is placed under the green zone category, but there is a fear that the virus could be imported from other states. Therefore, AYO said more efforts and attention should be given in manning the check gates. With the Union Home Ministry allowing interstate movement, AYO appealed the government and the concerned authorities to immediately set up proper screening facilities and further deploy a medical team at Kohima Gate in order to take stock of the situation in the best interest of the public. Union Cabinet gave its approval to a new centrally sponsored scheme named Scheme for Formalization of Micro-Food Processing Enterprises for the Unorganized Sector on All India basis with an outlay of 10,000 crore rupees. The expenditure will be shared by centre and states in the ratio of 60:40. The objectives of the scheme is to increase in access to finance by micro-food processing units, increase in revenues of target enterprises, enhanced compliance with food quality and safety standards, strengthening capacities of support systems, and transition from the unorganized sector to the formal sector, special focus on women entrepreneurs and aspirational districts, encourage waste-to-wealth activities, and focus on minor forest produce in tribal districts. Nagaland Power Department has appealed to all consumers to reduce the use of air conditioning facilities and judiciously use other power-consuming electronic gadgets. Chief Engineer DNR in a release informed the public that during this difficult period of containing COVID-19 outbreak, the power consumption, especially in Dimapur, is increasing rapidly, and the department is having a difficult time to handle this situation. He said if the power consumption continues to increase, the department would be compelled to resort to regular shutdown of power system and also start disconnecting the power supply of those consumers who are not paying their bills. With that, we end the morning news. Have a nice day.